Hematology, oncology, pharmacology, heparin. All right, guys. Sorry, my voice is kind of gone. I'm a little bit under the weather, but hopefully you guys can still understand me a little bit better. So first and foremost, we're just going to be talking about heparin. Heparin's really, really important, especially for clinical usage. But once again, we're just going to be focusing on the board's relevant material for heparin. The mechanism of action that they need you to know, okay, is that it activates antithrombin, okay? And we already discussed what antithrombin does, and all you really need to know is that since heparin activates antithrombin, it leads to a decrease in the action of our factors 2, which is thrombin, and 10, okay? And like they'll use it for, PE, for MIs, so pulmonary embolisms or, myocardial infarctions, as well as DVTs, deep vein thrombosis. And you're allowed to use it during pregnancy because it does not cross the placenta. They love to ask what you should monitor when giving certain drugs. Heparin, you're supposed to monitor PT, T. Okay, so sorry, that was a little confusing, but heparin, you monitor PTT. Warfarin, you only monitor PT, INR. Okay, so they like to ask that, but heparin, you have to monitor PTT. Okay, now, there are adverse effects that they love to ask about, and it's kind of hard to kind of differentiate it, but let's just start with the easy thing. If you want to give heparin to someone and then they have an adverse effect, which is obviously going to be bleeding, okay? So any medication that we use to treat, if I give you an anticoagulant, your obviously largest risk is going to be bleeding. Okay, so let's start off right there. So before we get into any of this other stuff, all these other medications, remember that key concept in your mind. If I thin out your blood, okay, which is essentially what heparin's doing, it's activating antithrombin, which decreases the action of thrombin, factor 2, and 10A. And those are key factors of the coagulation cascade. So if I inhibit those via antithrombin, then I'm just going to thin out my blood, and I have an increased risk of bleeding. Okay? Now, like they might ask this, but a common thing is that we can reverse these effects of heparin by giving them protamine sulfate. Okay, so protamine sulfate can be used to reverse heparin's effect by, blocking it from binding to antithrombin, which isn't that high yield, the mechanism of action, okay? Now, it can also lead to osteoporosis, which is relatively low yield, but the highest yield adverse effect that they like you to know is heparin-induced thrombocytopenia, or HIT, okay? And heparin-induced thrombocytopenia, perfectly named, it's just thrombocytopenia, so a loss of platelets, okay? So decrease in platelets due to the fact that we have heparin in our blood. Okay. Now there's two types, but what we really don't care about, what we care about mainly is going to be our type 2. Okay. So HIT type 2 is just due to the fact that we have antibodies against heparin bound platelets. So our heparin binds our platelets, and then now we have antibodies against these heparin bound platelets. So what these antibodies do, they begin to just kill off essentially all of our platelets. Okay. And what happens is when we lyse our platelets, we have the release of all the factors that are inside of our platelets that lead to coagulation, okay? So the activated platelets, they get removed by splenic macrophages, and we get thrombosis occurring. So we get a decrease in our platelet count because we're lysing them, and we get an increase in thrombosis, okay? So very, very important to understand that, okay? And the removal of platelets is via splenic macrophages. That's why we have a drop in that platelet count. Now, there are some notes that we need to discuss about heparin, and essentially, there's two different types of medications that we can use instead of heparin, and that's low molecular weight heparins, and they usually end in parin, so enoxaparin or deltaparin, okay? So they sound similar, they end in parin, but they're low molecular weight heparins, okay? They don't really like to test on this, it's not really that important, but they act mainly on factor 10, okay? Instead of acting both on factor 2 and 10, they act mainly on factor 10. And lastly, there's fondaparinux, which is another form, and that acts only on factor 10, okay? Now, these are not as easily reversible with protamine sulfate, so you're going to notice that quickly that you can't use protamine sulfate to reverse these. So that's why we really like to just keep with heparin, and they like to ask the questions about heparin. However, what they will ask you about for these is that if you have HIT, the heparin-induced thrombocytopenia, you have to stop heparin, and then you could provide them with these low molecular weight heparins or fondaparinux because you have a decreased chance of getting it. Also, you can start alternative anticoagulation like argatroban, which is coming up.